Hello and welcome to our second episode of podcast series for the community's Grand Cycle 8 under 8 minutes. I am your host Chinmay Kumar from Asia Pacific Regional Learning Hub. In our first episode, we explored the new landscape for tuberculosis. Today, we turn to the second critical pillar of Global Fund, which is HIV. To guide us through the must-know elements of key HIV priorities under Grand Cycle 8, we welcome Beatriz Thome, Senior Advisor HIV TAP Team at the Global Fund. Beatriz, thank you for joining us.
Thank you so much for the invitation to come talk to you.
So let's get right into the three big questions to you, Beatriz. My first question to you is, what is new or different in Grand Cycle 8 for the HIV compared to the previous cycle?
Thanks so much for this question. I think I'll start with what's new. I think the big change that's been introduced is that all the guidance for reprioritization and prioritization of investments really outline the investments that are of the highest priority. So I think that's something that's been even strengthened for Grand Cycle 8. And also outlining those investments that will require a strong justification to be added to Global Fund grants. So I think this ranking of priority for Global Fund HIV investments is what's mostly new. Otherwise, obviously, the guidance has been updated in terms of what's been released by the partners, by WHO, by UNAIDS, also in terms of optimizing health products. So the new guidance incorporates all of this and also reinforces that the Global Fund investments should be really based on evidence that's coming out of the programs, etc. And then that approaches should be really prioritizing those most in need. So it can be geographic prioritization or prioritizing populations that are most in need for HIV prevention, for HIV treatment, etc. And also trying to, as previously, tailor services to key and vulnerable populations as well. I think I should also emphasize what is not new. I think the key pillars of investment remain the same. As you see in the prioritization guidance, it follows more or less the modular framework structure of covering prevention, testing, treatment, elimination of vertical transmission, and all, of course, all the key investments at the community level in terms of ensuring that there's access to services.
Thank you so much, Beatrice. That's clarity on what different help us set the perfect stage for us to go into the second question. We keep hearing about program essentials. Could you define what these are for HIV?
Yes, for sure. So the HIV program essentials were introduced in GC7 cycle, and we felt that it was quite helpful to help design the grants. So they're really based on interventions and approaches that really address the ambitious goals that are set by UNAIDS in reaching the HIV targets. So it goes as well thematic area by thematic area. So we have a few program essentials for prevention, for testing, elimination of vertical transmission, etc. And again, they're key evidence-based. So it really brings to the attention of the program manager, of the health care worker, what are the interventions that are key in terms of addressing the gaps, etc. So we've kept the same group of program essentials that we had in GC7, but we've added a few new ones, again, aligning with the new guidance, etc. So, for example, we've added a program essential that speaks to access to testing and treatment for STIs for people living with HIV or at risk to be living with HIV or at risk of acquiring HIV, sorry. There's a new program essential on TB diagnosis for people living with HIV. So again, aligning with the latest guidance. There's also one that I think is very key on gender-based violence and how Global Fund grants can help address those within HIV services. So I think, again, these try to focus, again, going back to the idea that investments should really be prioritized even more so than before, given the current funding landscape. So these should really help countries target their investments, knowing that if they're investing those program essentials, they should be bringing more impact to their program. So really, it's something that we felt was helpful. This is why we're keeping it for Grant Cycle 8. As we review collectively together with partners, the Global Fund funding request proposals that will come in, we'll have a special eye to check if program essentials have been sufficiently covered.
Thank you, Beatrice. And to be very honest, to save time, just want to give you third question. In resource constrained environments, what are the critical considerations for adapting key population programs without losing impact?
That's a very important question and something that we are obviously worried about in general, given again the changes in the funding landscape. So the Global Prevention Coalition has released guidance around this that I welcome listeners to follow, because they're really trying to propose alternatives depending on two main axes, I think. One is on resources, which resources are available, and the other is the HIV burden. So they have a very helpful way to go about it and help plan and design programs coming from lower resource settings to more resources. So, for example, in the situations where you have fewer resources, let's make sure that the basics is covered. So, for example, that you have key population competent staff at the health facilities, at the pharmacies, etc. At the very least, if you have more resources to add peer education, for example, and then you focus on, again, targeting those most in need for prevention. If you have additional funding, you can add other modalities on the health facility that will do more counseling, ART, adherence counseling, etc. And then if you have really the resources you need, you can even go further and set up mobile clinics or clinics even that are dedicated to KP groups, etc. So this would be sort of like a pyramid that's really helpful to use, I think. And obviously using your epidemiology, what the information you have in terms of targeting those to the highest burden, highest incidence settings as well. But again, I think it will be a collective exercise. How do we, and then again, I think one point I didn't mention enough so far is the focus on integration for GC8, also with a lens of sustainability. So how can we make sure that to the extent possible, we integrate HIV services, including for key populations in the, for example, primary care setting, but in a way that we can really make those services friendly. And as you said, that we maintain the impact and the gains that we made so far.
Yeah. Beatrice, thank you so much for those insights. Our goal is simple. We want this cycle to be built with us and for us. Please share the video widely and subscribe to our YouTube and newsletter page. I am Chinmay Kumar. Once again, thank you so much for tuning in, and I look forward to seeing you in our next 8 minutes. Thank you so much.